Okay, today we are going to talk about invasive mechanical ventilation. What is mechanical ventilation? Ventilator is the machine which we use to maintain the oxygenation and carbon dioxide level in the patient. Usually the purpose of ventilation will be differ. Example, in the CNS affected patient we are ventilating. The lungs are good but we are ventilating because of the CNS issue. And at the same time there can be ARDS patient, there can be patient with pneumonia, there can be patient with COPD, various conditions. So today we are going to talk about all the basics behind the mechanical ventilation. Okay, then we are going to discuss what are the main 5 parameters you're going to know when you're handling the ventilator machine. First one, you need to know about the FiO2. Then you need to know about the tidal volume and also at the same time pressure support. Either volume, either support. Then you have to know about the respirator rate. Fourth one is PEEP. Fifth one is IE ratio. These are the main things. There is another small thing you need to know, that is trigger. All these words will be new to you, but anyway during this lecture I'm going to explain about all these things. So now we are going to think about what are the basic modes of ventilation. First one is assisted control mode, or we are calling it as control mode. Next one is SIMV, synchronized intermittent mandatory ventilation. Fourth one is CPAP, or your pressure support mode. So these all the words may be new to you, but stay with the video. I am going to explain each and every one very well so everybody can understand. So what is control mode? Control mode, all the parameters are decided by the doctor. Not a single parameter which is decided by the patient. All the things are decided by us, and usually the patient who are in the control mode ventilation, they are sedated, and most of the time they are paralyzed also, sedated and paralyzed patient. And there are two subcategories of the control mode. In control mode, as I mentioned, there are two main methods. First one is volume control, second one is pressure control. Volume control mode, we are controlling the volume. Pressure control mode, we are controlling the pressure of the airway. Volume in the lungs. As I mentioned, in the control mode there are two main categories, pressure control and volume control. In pressure control mode, usually the pressure is fixed. So usually airway pressure will be around 15 to 20 or 25 will be also acceptable. When we given the pressure, from the ventilator, when they are ventilating the lung, they are not going to exceed that pressure. Usually just think that the patient is having severe bronchospasm. Anyway, the airway pressure will be high, but the machine will not going to exceed the pressure and provide the volume. So in those sort of condition, volume control will be good. But the importance of pressure control mode is that this prevent barotrauma. Barotrauma is the trauma in the airway due to the high pressures. So the pressure control mode is very important to prevent the barotrauma occurring in the patient's airway. Next thing is volume control mode, where volume is fixed. So we have given the fixed tidal volume. According to that tidal volume, they are not concerned about the pressures. They only target is to deliver that tidal volume. To deliver that tidal volume, the pressure can go up. If you are not setting the alarm, pressure can be very high in the airway. So this is the two different method of ventilating. Usually in the ARDS side sort of patient, the lungs are very stiff. So we are usually using pressure control modes to prevent the barotraumas. Okay, the next lesson I will going to discuss about the SIMV mode.